Good evening, everyone. Godfred, can I go on? Okay, I will go on. You are all very welcome to today's Parents Roundtable discussion. We have about 23 people on the line, so I think we can start. So we can start early. Today we are talking about sleep. And since I'm a pediatrician, we'll be talking more about sleep in children. But I believe that everything we say here will also apply to adults. So as parents, as you listen, if you also have issues with sleep, I think you will benefit from this. Let me try and share my screen. Today, since it's me, I don't need any introduction. For those of you who are new to Parents Roundtable discussion, this is a Zoom meeting we have every month. This is our third season, which means we've been running it for 3 years. This is our third year. The aim of Parents Roundtable discussion is to educate parents about child health and child development. And over the last 3 years, we've been talking about different things that has to do with how we can help our children to optimize their development so that they can grow up to be the children God wants them to be. So today we are talking about sleep. Okay, I'm told the sound is not loud. Let me see if I can increase my sound. Is it better?
I can hear you loud and clear.
Okay, all right. Okay, so I hope everybody can hear me loud and clear too. So as I said, we are talking about sleep. So let me start sharing my slide. Okay. So you see why I didn't want to. Just give me a minute. All right. To start sharing my slide. I'm a bit confused now. I may have to, okay, here you are. Let me see, share. I can't find my, okay, please, can you see my screen?
Yes, please.
Okay, all right, I hope this is clear. All right, so we are talking about importance of sleep. Good sleep habits are very, very important for not only children, but even for adults. And I'm sure some of you, sorry, just give me a minute. I'm sure some of you have children who don't sleep well. Let's make this as interactive as possible. So if any of you have struggled with sleep in your children, please put it in the chat box so that we see that we are not alone. I personally can give you testimony that I struggled with sleep with my child for over 5 years. Can you imagine? Me that I'm giving the talk. I struggled with sleep right from the time he was born till around 5 years. And it was so stressful. I mean, if your child is not sleeping, you yourself, you are tired. It's like you can't, you feel so stressed during the day if you've not had a good night's sleep. And it can be terrible. If your child is sleeping well, it makes so much difference. So what do we have in our chat boxes? Did anybody share? Okay. All right. Oh, it seems like everybody is cool here. Okay, let's continue. So one of the constructs that remain largely a mystery in medicine is sleep. It is quite a new field in medicine, sleep medicine. And it's a big interest in science and research because we do not know everything that actually happens when we sleep. But every day, new things are being discovered. But one thing that we are sure of is that sleep is very important. And especially in children, it's a very important part of your child's development. And when your child is not sleeping well, it is linked to so many things: behavior issues, learning issues, emotional challenges, and we'll talk more about it as we go on. And for adults, since I can't leave adults out, for adults, lack of good sleep, optimal sleep, has been linked to heart disease, hypertension, stress, anxiety, depression. So you can imagine sleep is really, really, really important. Psalm 127 verse 2 says that he gives his beloved sleep. So for those of you who are still struggling with sleep, either yourself or your children, do not give up. As I told you, I struggle with sleep with my child for almost 5 years. But by God's grace, he's sleeping very well now. And when you wake him up crying in the morning, he doesn't want to wake up. So don't give up at all. There's light at the end of the tunnel. And I'm sure others will give you testimony that it won't always be like that. So today, let's learn about sleep. So as I'm saying that sleep is so important, we also know that too much sleep is not good. I mean, in life, too much of everything is not good. So Proverbs 20 verse 13 says that do not love sleep or you will grow poor. Stay awake and you will have food to spare. So this is, I guess, it's not for the children, it's for the adults. So adequate sleep is what we are talking about. You don't want to be sleeping too much. There are disorders and diseases that will make you sleep too much. And you don't want to sleep too little too. If you don't have enough sleep, then there's an issue. So today, this is our outline. We'll talk a little bit, I say sleep 101. So just an introduction about what sleep is. We'll look at the physiology of sleep, the benefits of it, and then we'll look mainly at bedtime problems. What are some of the problems that children face when it comes to sleep? And then we'll look at some conditions that are actual conditions and disorders of sleep. And we'll look at sleep in special populations. And then lastly, we'll look at what is sleep hygiene, sleep training, and what you can do to help your child to sleep better. So let's do 101 of sleep. So by 2 years, a toddler would have slept almost half their lifetime. So they would have slept like 9,500 hours or 13 months. By the time the child is 2 years, which is 24 months, they would have slept 13 months of their lifetime. And then by 2 to 5 years, they are awake and asleep 50-50. So between 2 years and 5 years, they are sleeping 50% of their time, and they are awake 50% of the time. By the time they get to childhood, to adolescence, sleep accounts for about 40%, including adults anyway. No, okay, adults is about 30%. So from childhood to adolescence, they are sleeping about 40% of the time. And for adults, we are supposed to be sleeping about 8 hours out of the 24 hours, which makes it about 30% of the time. Okay, so what is sleep? So sleep is really important. We are doing quite a bit of it in our lifetime. So why is it that we were created or programmed to sleep like that? Because it's important. So there's different definitions of sleep. I like this one. It says that sleep is a state of consciousness that can be described by reduced movement, decreased interaction, and responsiveness to the environment. And we do it in specific postures. And the important thing is that it's easily reversible. So if you are asleep and we cannot wake you up, that's not normal sleep. It's easily reversible. So usually specific postures, we all know that we sleep by lying down, our eyes are closed, etc. I mean, if you have somebody who sleeps when they are standing, that is not normal sleep. Or if they sleep with their eyes wide open, that's also not the usual typical way. So why do we sleep at all? So adequate sleep is required to sustain life and for optimal function. And sleep does different things. It's required for restorative purposes. So the brain has to be cleaned of all the toxins and waste products that is produced during the day. And that is called restorative part of and the brain function. It is when we sleep that this can happen. So if you don't sleep, it's like the brain is like a factory. It's just working. All the waste products and things are still there. It cannot get rid of them. It cannot, clean itself. It's when we sleep that happens. Sleep is also very important for learning. And the science tells us that when we learn, especially children during the day, when they sleep, that is when the new things that they have learned becomes consolidated in their brains, and then it's put into the memory bank so that when they need it the next day, they can then retrieve it and use it. So when a child is not sleeping well, it affects their memory, it can affect their learning, it can affect the way they are even, gaining information. Then lastly, sleep is also needed for growth. So children grow whilst they are sleeping. The growth hormone is produced during sleep, and then children grow. So our brains are very active during sleep. So many things are happening. The brain is cleaning itself, it's restoring its functions, it's helping consolidate new things that have been learned. So sleep is important. Insufficient sleep, what does it look like? So if somebody is not sleeping well, if your child is not sleeping well, what will it look like? So we know that children need more than 8 hours of sleep. I mean, from the adolescents right to the infants. The infants are sleeping between 16 hours, right up to the adolescents who need up to 8 to 10 hours. We'll look at the details later. But if you're not sleeping well, you may have excessive daytime sleepiness. It means you are dozing all the time. As soon as they sit in the car, they are dozing. They are sitting in classroom, they are dozing. They can have mood disturbances. So they are irritable, they are cranky, they are crying for no reason, they are angry for no reason, which will lead into behavior problems. They can take risk, impulsive behavior. They are not thinking through their actions before they do it. Then we talked about learning, how sleep is so important in learning. So if you're not sleeping well, it can affect your academic achievements in the classroom. And then if they're not sleeping well, they're all tired all the time. They don't have energy to do anything. There are certain groups of children who are at risk, so that if you have a child like that, you have to actually look out and make sure that this child is sleeping well, because they are at risk of insufficient sleep. So the poor and underprivileged, I mean, that stands to reason. If you're hungry, if you don't have a good place to sleep, if you don't have somebody taking care of you, by all means, your sleep will be affected. Children with chronic medical conditions, sickle cell disease, they may have pain. Children with asthma, they have chest tightness during the night. They may not be sleeping well. They may be coughing. Any chronic medical condition can affect your sleep. Children with autism, allergies, ADHD, whatever is happening in the family, if mommy is fighting with daddy or things are happening, it can affect the child's sleep. If they are watching too much TV or watching too much phone, screen time, it can affect their sleep. What if they are getting up very early? They are not sleeping early, but they are getting up very early because you live very far away and their school is also very far away. Or it's not far, but there's so much traffic that you have to leave. I know some families that have to leave their house by 4:30. Otherwise, they are going to be late to town because of traffic. If the children are not sleeping early and they have to wake up early, then it can affect them. Then a special group is the adolescents. So the adolescents, which is the age from, it used to be 13 going, now adolescents from 11, we add them to adolescents, the preteens. But they need 9 to 10 hours of sleep. But naturally, their sleep rhythm, or what we call the circadian rhythm, when they reach the adolescent stage, is shifted. So they tend to feel sleepy much later, 11 p.m., 12 midnight. And so if everything was ideal, they should be able to sleep till like 8 a.m., 9, and then go to school by 10. Unfortunately, it doesn't happen. So they are a big group that we should watch out for, our teenagers. So what is the recommended amount of sleep? So if you are born, newborns, they can sleep a lot, sometimes even 16 to 18 hours. They sleep, they get up for 30 minutes to eat, and then they go back to sleep. Then by 4 months, you see that they are awake more. So between 4 to 12 months, who are the infants, their total sleep, including the daytime sleep, is supposed to be about 12 to 16 hours total. The toddlers, 1 to 2 years, are supposed to be sleeping 11 to 14 hours a day. So remember, this is a range. Some people need more sleep, some people need less sleep. But this is the range that research has shown it is necessary for optimal function. The 3 to 5-year-olds need 10 to 13 hours of sleep. The school-age children, 6 to 12, need 9 to 12 hours of sleep. And the teenagers need minimum 8 hours of sleep. So 8 to 10 hours of sleep. And for adults, you also need 8 hours of sleep. So if you are not sleeping 8 hours, find a way to get your sleep. So let's go into details about functions of sleep. Please, if you have any questions, put it in the chat box so that when we finish, we will answer it. Okay. So let's look at the different functions of sleep. So let's look at cognition. I know for parents, you really want your children to learn. They want to be sharp brain. They want to be the first, 1% in the class. So sleep helps us to remember what we learn. It improves our executive functions. So when we say executive functions, we mean how we organize our thoughts, how a child can predict outcomes. If I do this, this is what is supposed to happen, how I avoid consequences, so that if you teach a child, don't do this, they don't continue to put themselves in harm's way by continuing to do it. They are goal directed. So it improves all these things. It helps their reflexes and reaction times. They react quickly. They work accurately and efficiently. They can think abstractly. They are not so concrete. They can think, abstractly. And then they can be creative. So all this is happening if you have good sleep. What happens when you sleep? So, I mean, I find sleep so mysterious because, I mean, you have this 8 hours, 10 hours where you can't remember what was happening to you. You don't know what was happening. All you are in your bed. Whatever happens, you don't know. It's so mysterious. But what happens? Some people have researched, and these are some of the things we know that happens when you are sleeping. As I already said, your memories are consolidated and they are stored. And this is necessary for learning. So everything the child is learning during the day, they're learning to walk, they're learning to talk, they're learning new words, they're learning different things. When they sleep, all these things are consolidated. It means that it's made stronger so that the next time they get up, the foundation is stronger for them to build upon it, to learn more. It helps you to concentrate and pay attention. So lack of sleep sometimes in children can present like ADHD, which is attention deficit hyperactivity disorder. If they don't have enough sleep, they can't focus, they can't pay attention, they are, short attention, they are easily distracted. Because sleep helps you to do that. Sleep helps your muscles to repair and recover. Look at these children, even look at us. We are walking, they are running, they are climbing, they are jumping, they are somersaulting. The muscles are being used. Some muscles will tear, some muscles will get hurt. When they sleep, the muscles will repair themselves and recover themselves. Metabolism is regulated. We'll learn somewhere along the line that if you lack sleep, sometimes it even affects your diet and can lead to obesity. It's like you can't regulate your metabolism properly. It just goes out of whack if you're not sleeping well, and that leads to stress, leads to heart disease. It helps to maintain better mental health and physical health. So individuals who are not sleeping well are more likely to be anxious, to get depression, all sorts of things. Sleep is very important. People can even use sleep deprivation for torture. So you can imagine. So what are some of the symptoms? Remember I said that they can present like behavior and emotional issues and challenges when they lack sleep. So let's look at some of them. So sleep deprivation symptoms, they can increase appetite, which then leads to obesity. If you are not sleeping well, then you want to snack. It's like everything you see, you want to eat if you are not sleeping well. It can affect your hyperactivity. So the ability to sit still in class or sit still when you're expected to sit. It can lead to excessive talking, unnecessary talking that doesn't even make sense. Accident prone, they become clumsy, falling down because they are not concentrating, they are not aware of their environment. All symptoms of ADHD. If you are not sleeping well, it can affect your memory. It can affect your concentration in class. It can affect your problem-solving issues, learning difficulties. If you are not sleeping well, you'll be dozing all the time. And then the funny thing is that if you don't sleep well, there's this feedback loop mechanism. If you don't sleep well, it is even more difficult to fall asleep again. Can you imagine? Then temper tantrums, defiant behavior, crying unnecessary, lack of patience. These are all symptoms of lack of sleep in children. Okay, now let's go to the physiology of sleep. Now I'm taking you into the classroom, and I will make this as simple as possible. So sleep is divided into two parts. We have what we call active sleep, and then we have what we call deep sleep. So there are two parts of sleep, and we refer to them as cycles. When everybody sleeps, including children, they go through these cycles. So they go through, these two cycles are called REM sleep, that is rapid eye movement sleep, which is also called the active sleep. So remember, active sleep. And this especially you see in babies when they are asleep, their eyes are closed, but you can see the eyeball moving, as if something is happening there. And newborn babies have a lot of the REM sleep. And this active sleep is where we dream. This is where dreaming takes place. Then we have the deep sleep. In deep sleep, there's no dreaming. This is where a lot of the restoration is happening. Active sleep is where a lot of the learning, consolidation. So each of the cycles have their function, and we'll talk about it. So just for this, remember that there are two kinds of sleep. When we all sleep, there are two kinds. There's the active sleep, which is also the REM sleep. And then there's the non-REM sleep, which is the deep sleep. The pattern is this. Everybody goes through them. You go through a cycle involves one of each, one REM and one non-REM. So most of the time when you fall asleep, you go straight into deep sleep. And then you come up a little bit into REM sleep, and then you go back into deep sleep. That's what happens. So just like you can see on your screens, you go deep down, then you come up to the light blue. That is the active sleep. That is very, that's the REM sleep. Then you go deep. As in the first third of the night is when you sleep the deepest. So the arm robbers and the thieves, they like to come at that time, because that time you are deep asleep. As morning is coming, the deep sleep doesn't go down so much. So it gets lighter, and then your active sleep gets longer. The importance of this is that children also go through this. And what happens is that when you go down into deep sleep and you come up to the active or the light sleep or the REM sleep, it's very easy for you to wake up. But you have, as a child or as a baby, they have to learn how to put themselves back to sleep. So if they sleep in your arms, or they sleep at your back, or they sleep whilst you are rocking them, or they sleep whilst they are breastfeeding, or they sleep with a pacifier in their mouths, or they sleep whilst there's a body close to them, whatever the surroundings were when they went into deep sleep, when they come up into the light sleep or the REM sleep or the active sleep, they can wake up. Everybody just wakes up. You see, you turn yourself small. If all the things that were there when you were going to sleep are not there when you are in active sleep, most people will wake up. And I always give this example. If you go to bed in your bedroom, in your nice, cozy room, and then you come up into active sleep and you are turning and you find that you are in the garden, lying in the grass, by all means, you are going to wake up. You're like, what's happening? This is not where I went to sleep. This is not what was happening when I went to sleep. Why am I here? And then instead of you just going back into deep sleep, you will now wake up wide awake. You can't sleep again. And that's what happens a lot of the times to our children. They may go to sleep around with certain things around them. And then when they come up to light sleep, if those things are not there, the pacifier has fallen down, the breast is out of the mouth, the body that was lying there is not there, then they wake up, then they start crying, then they walk to your bedroom. So that's the most important thing about this slide. Remember that during light sleep, children need to learn to put themselves back to sleep. So it means that when they are going to fall asleep, they should be awake and learn to put themselves back to sleep. Okay. Now, let's talk about characteristics of the REM and the non-REM sleep, or the characteristics of the sleep, active sleep and deep sleep. So in light sleep or in active sleep, the eye, I told you, is moving, is moving about. That's the time they are dreaming. The muscles can twitch, and a lot of new parents see this a lot because they like to watch their children sleep. Then they'll come, doctor, when my child is sleeping, then the muscles is jerking, his arm is jerking, his leg is twitching. This is very natural. So far as it's happening during sleep, it's very natural. Vital signs like your breathing pattern, your blood pressure, your temperature, your heart rate can fluctuate when you are sleeping. Your muscle tone in active sleep, it becomes decreased. It's like you're a dead person. It's very flabby. Dreams happen in active sleep. And then there are some EEG, our brain waves are very different between active sleep and deep sleep. So for adults, our active sleep is not a lot, 20 to 25%. Most of our deep sleep much of the sleep is deep sleep. We have to restore. For infants, it's 50-50. And then the infants between childhood graduates between the 50 to the 25 as they are growing. So in REM, especially in young infants, they have a lot of eye movements, and you see a lot of muscle twitching. Sometimes they'll do their faces certain things, especially the newborns. We call it facial grimacing. They'll do as if they are in pain, or sometimes they'll smile, or they'll do all sorts of things. Then they have irregular breathing. They'll breathe fast small, then they'll breathe slow small. All these things are natural in sleep in babies. So if you're seeing that, do not worry about it at all. Okay, this is just to show you that depending on the kind of sleep that is happening, your electrical activities in your brain is also changing. I won't belabor this point. So this is example of the sleep cycle I told you about earlier. I explained to you the sleep cycle. We all go first into deep sleep, and then we come up a little bit into light sleep, then we go into deep sleep. That's how it happens. In children, infants, so those under 12 months, their cycles will last only about 50 minutes. So every 50 minutes, they are likely to, move about, and they are likely to wake up. Then as they grow older, to the adult level, by the time you're an adult, your cycle lasts about 90 to 110 or 120. So for about 1.5 hours to 2 hours, that's how long your cycle lasts. And a cycle, remember I said, is 1 deep sleep and 1 light sleep. So you have a total of 4 to 6 cycles a night. So that's his physiology for you. So deep sleep, let's talk about deep sleep. What happens during deep sleep? In deep sleep, the synapses. So synapses are the junctions between the cells of the brain. The cells of the brain, they have to talk to each other for the brain to function. So when you are sleeping in deep sleep, these junctions prepare and restore themselves. They tidy the place up. They make sure that things are, chemicals are properly stored. If there are useless things there, some toxins, they get rid of it. This is what is happening during deep sleep. The body will repair itself. We already said it, the muscles will repair itself. Then there's growth of tissues. Children are growing during their sleep. Bones and muscles are building up during sleep. Then even the immune system is strengthened during sleep. So if you don't sleep for a very long time, you see that you start getting sick. If the adults, especially if you are stressed, projects after projects, you are not sleeping. No, you see that you are getting mouth ulcers, you are getting this, you are getting sick, getting colds and things, because sleep helps to strengthen your immune system. And then it increases neuroplasticity. So neuroplasticity is what we see in children, where the more they use their cells in the brain, the stronger the connections become. So when they sleep, it helps the brain to be able to do all these things. What about light sleep? So light sleep, which is the dreaming sleep, is also important. The hypothesis or the theory, as I told you, we don't know everything that happens, but we know that in REM sleep or the light sleep, useless connections are formed during the day are discarded. So as your child is learning things during the day, sometimes the brain will make connections that are not necessary and not useful. When they are asleep, that is where all the useless connections that are formed during the day are discarded, so that when they wake up in the morning, the connections that have been made are correct ones. It helps with memory formation. That's light sleep. It helps with motor skills. So there was they did an experiment where they deprived some rats of sleep, and those that they deprived, there are things that they are able to move through their burrows and through their tunnels. Those who didn't have sleep, they had forgotten how to get to where they were supposed to get to. Okay, so it helps, and this has been even done in humans also. So REM sleep also has its purpose. And then light sleep also provides oxygen to the eye during sleep. Okay, now let's go to bedtime. We're about halfway through bedtime problems. At this point, I've been talking for a while. Let me ask you, how many of you have had issues with sleep at home? I want you to think about the kind of sleep issues you have with your children. If you have a pen and paper, jot them down or put it on your phone. And then when I go through the bedtime problems and we are done, I'll ask you to diagnose what your child has. Okay, so you're going to diagnose what your child has. So let me give you 2 seconds to put it down. Think about it if you have any bedtime issues. Let's talk about bedtime problems. Okay, so bedtime problems are very common. So if you jotted something down, don't worry, you are not the only one. Lots of homes are having bedtime problems. In different articles, it ranges from up to 10% to 84%, depending on what kind of bedtime problem it is. And some of the reasons why we do have bedtime problems is because parents actually don't know some of these things that we are talking about, like these sleep cycles and the fact that whatever environment the child sleeps in when they go to sleep has to be the same. So some parents don't know. Other reasons could be that there's inadequate enforcement of bedtime limits. So I always ask some parents, so what time does your child go to bed? And a lot of the time, the children don't have a bedtime. They can't say, oh, by 7:30, they should be in bed. By 8 o'clock, they should be in bed. They sleep when they sleep. And if you leave children to sleep when they sleep, a lot of them won't want to sleep. It's as if when they are going to sleep, it's sheeing them, it's paining them that I have to stop playing to go to sleep. So there are no regulations around bedtime. And because of that, there are bedtime problems. And when there are bedtime problems, it affects parents because parents also can't sleep and it increases their stress. And then the whole house is on fire. There's stress in the house. Remember the circadian rhythm I talked about. Sometimes too, it's conflicting parenting styles. One person is like, you have to sleep by 8 o'clock. One person said, oh, let them watch TV small. Then the children start, playing around with parents. So conflicting parent styles can affect your give you bedtime problems. Sometimes busy parents, maybe after school, they'll go to the shop or they'll go and wait for mommy and then they are getting home at 9:30, or sometimes they want to see daddy before they go to bed and daddy is getting home at 10. So all these things can affect your bedtime sleep. So there are two main types. Of bedtime problems. Please remember this since you are going to be diagnosing your problems. We have the limit setting type and the sleep onset association type. So the limit setting type are the children who have stalling behaviors. So, they've gone to bed. Yeah, you've done very well. You've put them bed by 8:30. They're in bed. 8 o'clock, they're in bed. Then they come out. I want to drink water. I'm afraid there's a monster in my bed. I want to go and wee-wee. And they keep coming back. By the time you realize it's 10:30, 11, they are still around. They haven't slept. Or sometimes the outright refusal. They said they won't go to bed. They want to watch TV. And usually this starts after 2 years, especially when they can get out of their bed by themselves. Then the sleep onset association type. So this is what I described to you when we're learning about the sleep cycle. So in this type, the falling asleep is an extended process and it requires so many special conditions. Either you have to carry them on your back, daddy has to carry them on the shoulder, you have to walk with them, you have to put them in the car and drive around before they sleep, you have to rock them, somebody has to sleep by them, they have to put their leg on you before they sleep. These are the sleep onset association types. And so now that I've told you the two main types, let me pause here. Where is my chat box? At this time, I want you to give me examples in the chat box. If you have any of these issues, in your homes, limit setting type or sleep onset association type? Does anybody have any of these in their homes? So just put in the chat box whilst I continue, whether you have the limit setting type or the sleep onset association type. I saw something, somebody said they have both. Okay, sleep onset association type. Okay, good. So keep on putting it there and let's make it fun. So if you have really weird sleep onset association types, please put it there and let's see. And let's see how we can help you at the end of the presentation. So for the next type, we are going to talk about some of the really weird, unusual events that surround sleep. What we call parasomnias, just means sleep disorders or unusual events that surround sleep. So as I said, sleep is still quite mysterious and scientists are still learning about it. There's something called night terrors or sleep terrors, and it's quite common. I've heard about it a lot of time. And this, it happens between the ages of 4 to 12, and the child will wake up screaming like intense fear, as if they've had a nightmare. But this time, it's not like they just get up, oh, I had a dream. No, it's as if the thing is happening to them. They are afraid, they are flailing around, they are thrashing about, but they are totally asleep. Just a few seconds. But the difference between this and nightmares is that they don't remember that it happens. And remember that nightmares are dreams, so that's what occur during the active sleep. In sleep terrors, they occur during the deep sleep, so they don't remember. Then we have things like sleepwalking, occurs between 5 to 12 years. So these children are asleep. Even some adults do sleepwalking. They are asleep, but they get up and they are walking around. If you have a sleepwalker, it means that you have to be on guard all the time because they can walk, get out of the house. If you are upstairs, they can walk down the staircase, they can get hurt. It occurs in about 15% of children and it can cause injury, but it usually resolves by the time they get into the adolescence period. Then nightmares that are very common. That one can occur at any age and seen in children, seen in adults. Very common in children with anxiety issues and PTSD, post-traumatic stress disorder. If something really grievous has happened to a child, they may have a lot of nightmares. And these ones, they can recall the dream. And that's what distinguishes this between sleep terrors and nightmares. There's another weird one called sleep paralysis. This happens in the adolescents. And I'm sure some of you have experienced it before. So in sleep paralysis, you have a feeling of being conscious or awake, but you cannot move and you cannot speak. And you feel like there's some pressure or something heavy is pressing on you or you are choking. And the science behind it, or what actually is happening, is that the person is not moving smoothly through those sleep cycles, through the active and the deep sleep. There's some miscommunication in the brain and the body, and they are not moving properly. And it's very often happens in narcolepsy. Narcolepsy is a disorder in sleep where the person has an overpowering need to sleep at all times. So they're standing and they can sleep and fall down, or they're at work and they can just sleep. They are giving a talk and they can just sleep in the middle of the talk. That's narcolepsy. What are some of the other sleep events? These are more common. So we have these things called sleep-related rhythmic movements. So before the child sleeps, they may be rolling their head on the bed before they sleep, or they'll be banging their head against the mattress or any hard surface, or they'll be rocking their body before they sleep. This can be very common in children. Then bruxism is grinding of teeth. Some children grind their teeth when they are sleeping. Then sleep enuresis, this is bedtime wetting. This We only call it bedtime wetting when it's 5 years and above. And we are going to have a talk on bedtime wetting. So save your questions for that one. Then we have something called obstructive sleep apnea. This one is more worrying. These children or these adults, they are sleeping, they are breathing, and then at a time they stop breathing for some time. And then before they start breathing again, these can be very, very worrying in the sense that they affect the total restfulness of sleep. It can affect their concentration because the times they are not breathing, they're not getting oxygen into their brains. So it affects learning, it affects concentration and all those things. Then we have something called restless leg syndrome. In restless leg syndrome, this condition occurs where the person feels the uncontrollable urge to move their legs, and it happens usually in the evening or at nighttime. And the only time they get relief from this sensation is when they move their legs. So it can disrupt their sleep because they want to move their legs all the time. And a similar one is called periodic limb movement disorders. And that one, their leg twitch and they kick throughout during sleep. And that can affect their sleep. Okay, so this is a summary of the parasomnias. So I have sleepwalking here, sleep talking. I didn't mention sleep talking. Some of the kids too can talk during their sleep. Sleepwalking, we said injurious, it can hurt them. But sleep talking, that one doesn't hurt. But of course, sometimes parents, get anxious about it. Sleep-related groaning. This is another unusual one where they make loud noises whilst they are sleeping. We've talked about nightmares, night terrors, teeth grinding, confusional arousal. This is trouble understanding what they are doing or where they are during sleep. When you call them, they are very confused. Bedwetting that we'll talk about later. Sleep-related eating disorders. This is not very common, but it is possible, where they'll go into your fridge, into the kitchen and eat, and they can't remember they have eaten. And then other things. We've talked about all these things. So these are some of the sleep unusual events that can happen during sleep. Let's talk about sleep in special needs. I will not belabor this point. I won't talk a lot about it, but in case any of you have a child with these things, you need to look out for sleep problems. So autism, Down syndrome, and some of the other genetic disorders, they have specific sleep issues. So you should always talk about sleep if you have these conditions in your children. Other ones include the ADHD, depression, bipolar, anxiety. Those who are visually impaired, they can have sleep problems. So it's always good to check out if they are sleeping well. Then sleep and medical disorders. So children with allergies, it can affect their sleep. I have allergies. Last night I couldn't sleep because something happened and my ears and throats were itching and I just couldn't sleep. So children with allergies their sleep can be affected. Children with asthma, I've mentioned this already. Children with eczema, sometimes the skin is most itchy at night, and so they are scratching themselves so much they can't sleep. Children with reflux or GIT disorders like constipation, it affects their sleep. Children with sickle cell, epilepsy, all these children can have sleep issues. Obesity, they can have sleep issues. Let's talk about screen time and how it affects your sleep. So technology can affect your sleep. So when we get to the end and we are talking about sleep hygiene, what we are supposed to do, the blue light that comes from TV, phone, iPad, and things, it affects a chemical in the brain called melatonin. So if the children are behind the screen an hour, 2 hours to bedtime, it can affect their sleep. It doesn't allow them to sleep deeply enough, and their sleep is not restful enough. So it's very important for you to put off the technology at least 2 hours before bedtime. And most importantly, they shouldn't have technology in their rooms. They shouldn't have a TV in their room, especially the adolescents. You shouldn't allow them to take their gadgets into their room because they won't sleep. They'll be on it and it can affect them. Okay, I think I'll go. This one, we've talked about it already. I needed to talk about this. Mummies and babies back to sleep. So I'm sure you've heard about back to sleep campaign. And your doctors have told you that if you have a newborn baby under 12 months, it's better to put them on their back in the sleep, in the cots or wherever they are sleeping, on their back and not on their tummies. I know a lot of babies sleep better when they're on their tummies. So it's very difficult for moms when the doctors say you should put them on their back. The truth is that for us in Ghana or in the African countries, we haven't done our own research. So we are using what the Western countries have said. So before 1994, there was a lot of sudden infant death syndrome. This is a child, usually 6 months, a year, healthy child, there's nothing wrong. They get up, parents get up in the morning and the child is gone. And they do autopsy and there's nothing. And so they decided through all sorts of things to do this back to sleep, because they're wondering, they put them on their tummy, maybe when they're in deep sleep and they can't lift their head, sometimes they suffocate and then it causes death. But when this launch happened, the back to sleep, 50% of SIDS, which is sudden infant death syndrome, went down 50%. So it showed that they were doing something. Having said that, SIDS happens in Ghana, it happens in our environment. It's not as common, but it does happen. So we advise, so we do our own research and we see whether it's not a problem or not. We do advise as much as possible that you should let babies sleep on their back. Okay, now let's delve into how we can help have a good night's sleep. So exposure to morning sunlight is very important to set your natural internal clock for the day. So it's very important that all of us, when you get up in the morning, not only the artificial LED lights, open your windows, open the curtains, so you have natural sunlight. It's able to set your internal clock for the day so that you can sleep better. And it's very important for the newborns. You know, when they are born fresh, sometimes they will sleep during the day. And then at night when you are tired, that's when they are up and they want to play. If you are able to expose them to the sunlight, early natural morning sunlight, it helps to reset their internal clock so that they are awake more during the day and then they are asleep at night. So let's look at some important sleep hygiene practices. It is important to establish a nighttime routine. A nighttime routine is very important. It helps to sort of put the brain into motion that, okay, it's time to sleep. As soon as I start brushing my teeth and I go to bed and we read a story and we say our prayers, it means it's sleep time. The lights are going to go off. You have to set and establish a nighttime routine. It is good to get up and go to sleep at the same time. I'm saying this for children, but it goes also for adults and teenagers. It's very important to go and sleep at the same time and get up at the same time, even on weekends. It's good to create a healthy sleep environment. Your room where you sleep should be comfortable. The bed should be comfortable. Wherever you're going to sleep should be comfortable. They said even your phone shouldn't be near your bedside, because every time there's a beep from a message on Facebook or something, you want to take it. So put it off and take it far away to charge it. It shouldn't be near your bedtime. It's good if the room they are sleeping in is a bit cool. If it's hot, they can't sleep. It needs to be a bit cool. Turn off all the electronics. They shouldn't be hungry when they are going to bed, but they shouldn't have also eaten a very large meal, because if you eat a big, large, fatty meal, then the food is not digested. And when you are sleeping, you are going to get reflux and you can't sleep well. It is good for them to have good exercise during the day, including as adults. Good exercise during the day helps to reduce stress and helps you to sleep better. Then, of course, you want to limit things like chocolates, which will reduce your sleep. For the adults, you want to limit caffeine. So for the children, they shouldn't be drinking things like Coke and things in the evening before they go to sleep. Okay, so healthy sleep hygiene in kids. This is a little bit of what we said. Go to bed and wake up at the same time. Avoid caffeine consumption. Expose yourself to bright lights. Expose the children to natural morning bright lights. Make sure that the room is really nice and comfortable for sleep. Your bed and your pillow should be, adequate. Don't be hungry and don't be too full. Develop a routine. Reserve your bedroom only for sleep. No TV and cell phones, games, all those things should be out of the room. So this is an example of a bedtime routine. So bedtime routine, and for somebody, this will take 30 to 45 minutes. So they'll bath, they'll brush their teeth, they'll go and sit on the potty, they'll read a book, they'll pray, and then they'll go to sleep. This is an example of a bedtime routine. It doesn't have to be like that in your house, but look for something that you can do the same routine. The way it comes after the other, it shouldn't be, haphazard all the time. It should be the same way. It should start at the same time, approximately the same time. And it really helps them to go to sleep easier and stay asleep. Let's talk about sleep training. So I put this here. Some of you may have heard about sleep training. So sleep training is not a necessity. It's not a health necessity. I'm not saying that you have to sleep train your child. It's a choice. But it can be beneficial to sleep train your child such that they can sleep by themselves and go to bed by themselves and stay asleep by themselves. So sleep training just means teaching an infant how to sleep independently. Usually they say that it's ideal between 6 to 9 months. And the principles of sleep training, as I said, is just to teach yourself teach your baby how to self-soothe and separate yourself from your baby, so that during the nights when they are alone in their bed, if they get into the light sleep, they can go back to sleep by themselves. The principles include that you need a consistent bedtime routine, a consistent time to go to bed, and there's no right way. There are different ways to sleep train your child. Some of the methods would be the cry it out, which people don't like. I also don't like it so much. The Faber method, check and console, fading, no tears. We can talk about it some other time. So just a summary. So the Faber method is a graduated extension, increasing the amount of time the baby cries before you go in. So you put your baby down and then you say good night. You are sure your baby is not hungry. The diapers are clean, everything. The baby is sleepy, you put your baby down and then you go. Baby starts crying, then you come in, console, then go, and then you increase the time in between when you are coming in and when you are waiting till the baby can sleep by themselves. And there are a different variation. So the extreme is the cry it out. You put them in the bed, they are not hungry, nothing is happening to them, and they will cry it out and they will sleep. That is faster, but it can be very stressful for parents. And then the no tears is you keep consoling them, but you do not take them back into your bed or carry them. So you still keep consoling them till they learn how to fall asleep. That one is longer, but at least you know that you are consoling your child. So it depends on your family, whatever you want to do. But as I said, sleep training is not a necessity. So this last slide, or last part one slide I put in, there are times when sleep is really an issue for the child, especially in some of the conditions I talked about, like autism or the visually impaired and those things like that. we do not give children sleeping tablets. And I've heard this many a time in my consulting room. Doctor, don't you have anybody seen that to make them sleep? We don't give children sleeping tablets. And even for adults, sleeping tablets are not really good for us. So, but there are a few things that people anecdotally have said that help. So the first one, melatonin, that's one I said we do give. So melatonin is the chemical in the brain I talked about. That's the natural chemical, sleep chemical in the brain. For some children, like children with ADHD or children with autism or visual impairments, they have very little melatonin. So you may do all these things I'm saying and they still are not sleeping. So sometimes we do give them melatonin to help them to sleep. But there are some natural methods that I've heard from parents. So I put here that you may want to try. So chamomile, whether it's going to be a tea or it's going to be a fragrance in the room, passion flower, lavender aromatherapy, lemon balm, massaging, white noise, music, cool music, a cup of warm beverage, all these things. People say that it helps them sleep. So I just put it there. So in conclusion, sleep is absolutely vital. I mean, from the things I've said so far, all the functions of sleep, right? From your immune system to your learning, to your muscle repair, to all these things. We know that sleep is absolutely vital for children, for growing children especially. They need to sleep, and sleep directly impacts their learning, their mental health, their physical development. And whilst they are asleep, they are able to consolidate and make sense of what they have learned during the day. So it's really, really important that we have a good sleep. So this is the end of my presentation. I've put this there. I think this is our Instagram. What is this thing called? QR code. So for those of you who are new to us and you want to share to keep up joining us in our programs, you can use your phone and get to the place so that you can follow us. Thank you very much. Let me stop sharing and then we can answer questions. Do I have any questions there? Let me start. Let me look through. Okay, plenty questions. Oh, wow. Okay, let's start from the beginning. So, my child is 13 and still wakes up at night. Even yesterday, he woke up. So I'm hoping, okay, so, I have a few questions on the chat, in the chat box. Please let me read it out and then I will call those who have their hands up, please. Okay, so my child is 13 and still wakes up at night. Even yesterday, he woke up. Well, I'm hoping that after I have ended this thing, you got something that can help you with your child. As we said, sleep hygiene, check your bedroom, check the bedroom, make sure screen time is not too near bedtime, have a bedtime routine, make sure the room is comfortable, and then let's see if that is not working and we think there's a more, there's a medical issue, then please visit us and let's talk it out. So Ophelia says that it's very true. I end up with headaches, puffy and red eyes because my kids don't sleep. I'm telling you, it's not a joke. If your children don't sleep, it's terrible. It can just stress you out. And then the next one says, wow, this is a lot. Okay. I have both. So somebody has both the limit setting time type and the sleep onset association type. My 2.5-year-old has the sleep onset association type. He usually requires someone to sleep by him before he can sleep. So I can see that there's a lot of sleep onset association types going on in your homes? Okay, good. Okay, so a lot of sleep onset association type. My 12-year-old likes his daddy to lie beside him before he sleeps, or even sitting in their room. When he wakes up and daddy isn't there, he comes right out the door and starts knocking. I'm telling you, this is sleep onset association type. But by 12, we have to do something about this. This is Sylvia. Okay. Somebody has Brooks the same. Okay, thanks for the presentation. Okay, I think there are no questions. Let me go to the hands up. My baby will only sleep if it's myself or daddy has to put them to sleep. Okay, Nana Kwa. You can unmute and ask your question.
Thank you so much, Doc. So I have to say, I mean, my daughter's sleep has improved recently with huge thanks to Mission Clinic. But I'm noticing a slight regression. It's not serious. I just wanted to mention it to get your advice. One of the things I noticed when we started sleep training her was that suddenly she started pooing in the middle of the night, which she never used to do before. She only used to poo like late afternoon. And, you know, so when we've kept her in the room, what's happened then? It's like, then of course it means she would have her diaper on for a long time, which I realized also caused her to get a bit of an inflammation. And so now when she cries in the middle of the night, I feel the need to go and check, you know. And, you know, I've realized that, okay, now she sort of sleep till midnight, and then at midnight keep waking up like every 2 hours. But when you take her back to bed, she will go back to bed, and I'm kind of unsure of what to do about it. But at the same time, huge improvement because she will go back to bed, and we've stopped like sleeping by her and all of that kind of stuff.
Yeah. I'm glad that there's been some improvement. What our advice is to try and put her on the potty before bedtime. I mean, there are two things that could be going on. It could be that she's now sleeping much better, and in her relaxation, if there's poo in the rectum, in your relaxation, by all means it will come out. And she's not old enough to, you know, to sense it and get up and go to potty and come back to sleep. So if you can give her a good sit, at least 10 minutes on the potty before bedtime, so that if there's anything in there, it will empty. I think that may help. But naturally, when you start sleep training, there's something called the extinction method. So it starts going well, and then something happens, and then they crank up the irritability, anything to go back to the past. But you have to keep on, and then it gets better again. So please don't give up. Try the sits before bedtime, and let's see if it helps. Okay. Alice.
Okay, so Doc, so thank you so much for the presentation, and I think it's very insightful and very deep. I'm grateful that you've been able to share this with us. My question is very simple. What is the best sleeping time for kids?
Okay. When is the best?
Because sometimes, yes. You know, sometimes people give different sleeping time range, and sometimes if you look at what we have to go through with them in our schedule from the offices, sometimes you come home, you have to come and assist them to do their homework, and by the time you are done, it's almost like 8 p.m. or something. So I just want to know, and the traffic that we have to go through, you have to make sure that you wake them as early as possible so that you'll be able to beat the traffic and get to office on time. Other than that, you're going to have problems with your boss all the time. So I just want to know the specific or the correct sleeping time so that, I mean, it will guide us to be on point all the time.
Yes. Okay, thank you so much, Carlos. So one of the slides that I put on, so the sleeping time, the appropriate or the adequate one actually depends on the child's age. So it ranges from 16 hours for the newborn to 8 hours for the adolescents. So depending on your child's age, I will bring up that slide again. Depending on your child age, you should have an idea how much they need. So for example, school age going children should have an average of 10 hours of sleep. So then depending on when they go to sleep, you can use when they are waking up to know when they are supposed to go to bed. Remember that this is a total sleep. So if they are less than 4, then they could be having nap times during the day, and all is part of the total they are supposed to sleep. But generally, if I were to say, children between 8 p.m. and 9, they should be asleep, especially if they are going to school the next day. And these days, most families will leave the house before 6 o'clock or 6:30. So definitely by 8 o'clock, they should be asleep. Carlos, I hope this is helpful. I'll try and get the slide of the different. Let me know how old your children are, and then I'll let you know exactly. But
Okay, so,
by 8, they should be asleep.
Okay, so I have 4, and 1 will be 6 this month. So let's say I have 4 and 6 now.
Okay. So 4 and 6 months. So definitely they
No,
will.
no, 4 and 6 years.
Okay, 4 and 6 years. So definitely both of them will need an average of 10 hours of sleep a day, total hours. So if they are not sleeping in the day at all, and usually by 4 years, after 4 years, they don't nap during the day anymore. In fact, some of the preschools after 4, they don't even give time for them to nap. So they should be having averagely 10, give or take 1 hour. So by 8, they should be asleep. Alice, I hope that's okay.
Yeah, that's fine.
If you are getting home after.
The other problem is, like what somebody said, they always want to sleep by me. And that is the problem. So now I'm being forced to go home as early as possible. I cannot afford to stay late because I want them to sleep early. And anytime they are sleeping and I'm not there, it's a problem. And when they sleep and they wake up and they realize that I'm not there, they will rush and come and sleep with me. And I think that's also disturbs their sleep. I don't know if there's something that can be done so that we're going to have a continuous sleep. Or if I had to find a way not to put them to sleep, that they wake up at any time to be looking for me.
Yeah. So this is the sleep onset association type. Remember what we said, there are 2 types, the limit setting and the sleep onset. So they cannot sleep by you unless you are prepared to sleep by them the whole night. Otherwise, they'll continue to wake up. So for 4 years and 6 years, I think they should understand. So you should try and get them to fall asleep by themselves. You can start with just sitting by their bed, but not on not sleeping by the bed, but sitting on a chair by them. And then slowly try to get them to sleep. It is difficult. It may take you from 2 weeks to 6 weeks, depending on how resilient and perseverant your children are to sleep by yourself. But the whole point is to get them to sleep by themselves so that they don't need you to sleep. If they're able to go to bed by themselves and they don't need you to sleep, then they'll stay asleep. So a 4-year to 6-year-old, you can do the bedtime routine with them, put them in bed, say that this is the new rule. Daddy does not sleep with you. You have to go to bed. You pray with them, everything, and leave them there and say they're not allowed to come out. If they are going to cry, then you may have to do it gradually. But I think 4 to 6, they are old. They can sleep in the room without crying. But if they can manage to sleep without you, they'll stay asleep without you. So all the best, please try it and see. Okay. Any more questions? My 18-month-old girl sucks her 2 fingers while holding her navel. Yeah. So for that, because her fingers and her navel are always with her, that one is okay. But it's those who have like the pacifiers to sleep. As soon as they sleep, and the pacifier falls out, and then they get into light sleep and they wake up and it's not there, they will start crying, they wake up, and then you have to go and put the pacifier back. So I don't advise using pacifier to sleep. Okay. Okay. No more questions. Okay. My 3 boys, 7, 4, and 1, sleep routine got changed after Christmas. We are in bed by 8 p.m., room is cool, no device, brush teeth, potty checked, a story and prayer time. They are up by 6:30 and our stress levels have decreased. Awesome. This is a testimony by somebody. Awesome. So they did a sleep routine and they are asleep by 8 p.m. and they wake up at 6:30. Stress levels have decreased. It's really important. That's something that if you have sleep issues in your house, make it a point that you are going to deal with it within this quarter. And I tell you that it will help your stress levels a lot. Okay. Carlos, your hands are still up. Is it the old one? Okay, I think
Oh,
it's
yes,
the
the old one. Yes, let me
okay.
drop it.
Okay, all right. I've dropped it for you. Okay. Somebody says, so please, when will she stop sucking her fingers? How can I stop her, please? She has become so attached. So this question, I'm the wrong person to ask because me, I sucked my fingers till I was 6. My mother says she took it to prayer square. It didn't work. So for sucking of fingers, I mean, what others have done is to try and get them the sucking to be unpleasant. So they put all sorts of things on the fingers. But if you were like me and you are determined to suck your finger, nothing can stop it. I've not seen any adolescents I've seen adolescents suck their finger, but I haven't seen any adults suck their finger. So that one, be sure that it will end by all means. But you can try putting aloe vera, putting some bitter nail polish, Marmite, something that is bitter on the fingers and see if it will help. Good luck to you. Okay. Thanks so much, Doc. My 11-year-old son had to do a presentation at school and he couldn't sleep the whole night. How do we manage this? Hopefully it doesn't happen in the future. Yes, so this is just anxiety. This is anxiety. He had to do a presentation, so he was thinking about this. My son, when he's going to a new class, will not sleep the whole night just because he's thinking about it. I mean, any way to reduce his anxieties before a big event can help. So breathing exercises, just for 11, cognitive behavior, just telling him that he knows the presentation, he knows it, he did it. The people sitting there don't know the presentation, he has control over it. Just help him to know that he's in control, so he doesn't need to be afraid. And as he gets older, it will get better. These days, I do presentations without even blinking an eye. In the beginning, I would also be very anxious about it, thinking, couldn't sleep. Sometimes, even getting diarrhea before you get a presentation. So that is natural. Okay. I have a 7-month-old girl. She wants to sleep on you. And she wakes up suddenly crying, virtually wakes up with crying while she's sleeping on you. Nina, is she waking up while she's sleeping on you or when you put her down? If she sleeps on you and you put her down, when she wakes up, she will cry. This is sleep onset association type. So please check it out. She has to sleep by herself on the bed where she will stay asleep there. Somebody has seen an adult sucking their finger. I actually know an adult who sucks their finger, but they don't suck it in public. They suck it only when nobody is around. Okay. You said earlier that some children wake up grumpy when they don't get proper sleep. But Doc, others too wake up grumpy after even over 10 hours of sleep. Could that be another problem? Yes. That could be another problem that is not related to sleep. Unless this child needs 14 hours of sleep and is getting 10 hours of sleep, then they can still wake up grumpy. But yes, it's not all grumpiness during the day that is due to sleep. Okay. All right. Okay. So Nina says it's when she sleeps on the bed. So yes, Nina, so that's a sleep onset association and bedtime problem. If she sleeps on you and then when she's asleep, you put her on the bed. When she gets into her light sleep or her REM active sleep, she will realize she's not on you. She's going to wake up crying because you have disturbed her sleep. So you have to try and get her to sleep when she's on the bed. And some of the children like the body contact. So if you let her sleep on the bed, she'll keep on crying, but you have to continue till she learns how to sleep on the bed. Okay, so it's 6:20. Oh, Lizzie, you have a question. Please unmute.
Okay, I don't know if it's a contribution. I'm a teacher, actually, a preschool teacher. And I think the onset association type, it's occurring in most children. And sometimes we, the teachers, they come early in the morning and they are tired and they want to sleep. And you want to lay them and go and do other things. And the child feels you have to come and lie by him or her for the child to sleep. I think it is a procedure, or it's something that if you consistently do and let them sleep by you or sleep by them, it becomes an attachment. But if you start with the procedures and start leaving them, they will fall asleep on their own, because at school we don't sleep by them. I can't sleep by you. I can't sleep by you. And so as a contribution, and then maybe a suggestion to the parent at the early stage, maybe we want to pamper, but that too, I think they should be getting used to those sleeping proceedings. Thank you so much for the presentation.
Thank you so much, Lizzie, for your contribution. Indeed. I mean, think about it, that you cannot sleep by them forever. I mean, what is going to happen? You can't have this 16-year-old boy sleeping in your bed. It's not possible. And so for those who haven't already have older children, you have young ones, it's easier to sleep train them when they are young, below the 2 years, where they can't climb out of the cots or they can't climb out of the bed. It's easier to train them at that 6 months age. If you can, and you have the akukudo, I bet you it's better that way. Yes.
Hello, thank you very much for the presentation. Mine is a contribution. When I had my child, he slept very well throughout his infancy through to his toddlerhood. But when he started understanding language and all of that, I realized that people started scaring him with darkness. So what happened is that whenever he did something that he wasn't supposed to do, they would say kakai. So he started associating darkness with kakai. And so sleeping in darkness became a problem. And that is when we started having all of our issues. So now it has to be mommy sleeping by him, having the lights on and all of that. But gradually we are getting there. He's now 7, but we are getting there. So please, Ghana for ne kakai any we beg you. It's okay. Thank you very much.
Thank you so much for the contribution. Abigail.
Hello. Thank you so much, Doc, for the presentation. I had an interruption in the network, so I don't know whether you've said this thing. It's a question too.
Okay.
I have a 2.5-year-old boy. They are twins. One sleeps throughout the night, but the other one doesn't, and it's been there for a long time. I remember sending him to the pediatrician one time. We checked the sickling status, thinking probably it's a sickle cell something, but he's not a sickle cell child. He sometimes rolls and hits his brother, even with the eyes closed. He can be crying, the eyes are not open, he will be turning a lot in bed, and he still does it. Initially, we thought probably he's not eating well. That is how come it occurs. But we try and feed him well before he sleeps, but he still does it. So I want to know whether it's a condition or it's just one of those sleep disorders that can just go with time.
So Abigail, is he asleep whilst he's rolling, or is he getting up and not sleeping?
No, still asleep.
Okay. So, I mean, if he's still asleep and when he wakes up, is he rested?
No, because of that, when his brother is awake, he will be sleeping before they started school. In the morning, he would sleep and then wake up maybe sometimes around 9, getting to 10, because he couldn't sleep well
properly
in the night. Yes.
Yeah. So this doesn't sound like the two common ones we talked about, which was the limit setting type or the sleep onset association type. It sounds like he's moving a lot during sleep, and maybe we mentioned one called the restless leg syndrome or the periodic limb movement syndrome, where the restless means they are just restless and they are moving, guns to say a war washer. He starts from here, he will end up on the floor, that kind of thing. Those ones, they usually get better as they get into the adolescence. They are also a bit better if he has iron deficiency anemia and you check that out and they treat it. Sometimes it helps, but it sounds more like something that he needs to actually be assessed for. We need to make sure that he's breathing properly during sleep. So we have a few areas in Ghana where you can do sleep studies so that they see his vitals and his breathing movements and everything during sleep to make sure he's not stopping breathing and making him restless. So maybe you should come by and let's talk and see what we can do for him. Okay.
Oh, okay. And sorry, please, he is very hyperactive during the day. So I don't know. Sometimes my mommy says it's because of the nature of his hyperactiveness during the day. That is what makes him hyper at night too. I don't know.
So I mean, so if he's asleep, then he shouldn't. But yes, it's true. Remember, I've said that there are kids with ADHD, which is attention hyperactivity disorder, who naturally are very restless during sleep and have less melatonin, so don't sleep well. So please, if he's only 2.5, give him some time though. Give him some time. But you can always come by and let's look at this properly, okay? Okay. So if we do not have any more questions, it's almost 6:30. And I think we can bring our meeting to a close. Yes. Oh, okay. One last question. Zoom user.
Thank you very much. So I have a 12-year-old and he sleeps very well at night. Like once he goes to bed, he's sleeping. But he's very hyper, like he's very active during the day. And he hardly sleeps on time. You actually have to literally coax him to go and sleep. And I feel like it's affecting his studies somehow because his concentration span, he's able to concentrate only a short while. He stops, plays a bit, comes back to continue. So I don't know whether that's also a condition or it's just natural of him. Because once he's sleeping, he can lay in the same position till maybe morning or something.
Okay, so for not sleeping early, I advise you do the sleep hygiene and the sleep routine and get him a bedtime. If he said he's 12, if he's 12, he should be having.
Yes, he's 12.
Yeah. So if he's 12, he should be having 8 to 10 hours of sleep at night. So if he's having that and he's still having concentration and focus issues, then that's something that has to be investigated. As I said, it's not only sleep issues that can cause focus and attention issues. Sometimes it could be a primary issue with attention and focusing, which is ADHD. We've talked about that before. Attention, they have issues with attention, focusing, easily distracted, and then they can also have issues with sleep. So make sure he has a sleep routine. He's sleeping at the same time every day, and then the hygiene in the room and everything is okay, not having any excessive screen time which can affect his sleep. And if that is still an issue, then you should get him assessed for the attention issues. Okay. Faiza. Okay.
Hello, good evening.
Good evening.
Okay, so my name is Faiza, and I would want to say
Faiza.
thank you for educating us. We've learned a lot. Okay, so I have a 3-month baby. She'll be 4 months next week. She hardly sleeps in the night, and also sometimes she would just cry, just one line of cry. I don't know how to put it. You just hear her cry, then she'll go back to sleep. I don't know if it's normal.
Yes. And Faiza, it's very normal. You remember I said that the infants, they have a lot of active sleep. So active sleep is the one that they are dreaming a lot. So they can either be crying, smiling, laughing, making faces, twitching, all sorts of things they do in their sleep. 3 months is a lot. Don't carry her each time she does one line cry. Maybe she's crying about something. Maybe she's crying because she thinks the breast is coming to her mouth in her dream. We don't know. But so far she's sleeping, just leave her to sleep. When they are born like that, they have their internal clock is not set. So they sleep more during the day and they are awake at night. The way to do it is to make sure that every morning you open the window so that the natural sunlight will come in. Don't newborns, people, parents will say, oh, my child is sleeping during the day, everybody should keep quiet. So during the day, make as much noise as you can so that she starts learning that the day is for waking and the night is for sleeping. For the nights when you are asleep, you don't play, you have dim lights, you breastfeed her when she needs and you put her back, no playing whether she's awake or not, no holding. And then gradually she's going to set her internal clock and then get better at it.
Okay, thank you very much. Thank you.
Okay.
But sometimes my work demands that I come home very late, and when I come home, sometimes she's asleep. Do you think it's advisable to wake her up to bath her, or I should just leave her to sleep?
Oh, leave her to sleep, my dear Faiza. Leave her to sleep. She's only 3 months. She's not running or sweating. She's not dirty. Just leave her to sleep.
Okay.
Okay.
Thank you very much.
Yeah. Okay.
Bye.
All right. Okay. So we're going to end this next month, 3rd week in March. We'll be having another parents roundtable discussion. I'm trying to remember what topic we are doing, but I can't remember. Godfrey, do you remember?
Yes, tidbits in pediatrics.
Great. So for next month, we are doing tidbits in pediatrics, how to prevent home accidents, all the different things you wanted to ask your pediatrician that you've never been able to ask. We are going to have seasoned pediatricians who are going to talk to us and you can ask all your questions. So make a date with us next month. Please do not, save the dates in your calendar so you do not forget. And then we'll send the flyers around when it's near time. For those of you who are not on our Parents Roundtable page, WhatsApp page, and you want to be, I think they've put a link here so you can check it out and join it. Somebody asked if this is a CPD accredited. Yes, this is CPD accredited. You have to fill a form for registration and let us have your MDC number. It's only for MDC accreditation, Medical and Dental Council accreditation. So we have a registration link. If you register, then we can get your CPD credits for you. Okay, so thank you very much and see you next month. The link has been put here. Titi, the link has been put just above in the chat box. So please. Okay. Godfred, is that the link for the registration?
Not for the WhatsApp platform.
Okay, sorry, that link is for the WhatsApp platform. But if you get onto the WhatsApp platform, we'll get the registration for CPD credits for you. So please get onto the WhatsApp platform and you get lots and lots of other information. For those of you who want to listen to this talk again, or for other family members who you think it will be good for, you can listen to it again on our Facebook page and also on our YouTube channel. I think the links have been put down. Thank you very much for joining us, and see you next month. Bye-bye.
Bye.
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 Bye.